mainstream media are not part of proceedings of this House. And therefore, I would be abusing your own standing orders if I started talking about people who are supposedly supplying these things and mention members of parliament, mention members of the Senate in accordance with the social media that is there in today's saga. So, Madam Chair, I would just like to avoid that whole thing and to say that...
Madam Chair, point of order. Okay.
Order, Chair.
What is out of order, Honorable Cross?
Yes, I want clarification from Bwana Wasiri, because if he is saying he can't rely on social media or propaganda, then why is now then the CEO of KEMSA at home if he's not relying on propaganda and all that, and he's really denying the facts? Bwana Wasiri, you know, when you're a politician, it's hard to deal with a politician when you're dealing with other politicians. Please now, be very specific.
It is because we are not relying on innuendo, we are not relying on newspaper reports, we are relying on recommendations from investigating agencies. It is not the same thing. It is agencies that are carrying out investigations that have come to us and told us on the basis of the ongoing investigation, it would be, and recommendations made to the board, that it would be in the interest of the institution if certain people are to step aside to allow for further investigation. So it is not from newspapers, Mheshimiwa.
Madam Chair, point of order, Madam Chair. Is it in order, Madam Chair, for Waziri to cast aspersion on the commitment of the media in playing their oversight role, or any other player who is not a state actor in playing their role in exposing the rot in the society? We've done many investigations in Parliament here, and I will bring it to your attention that most of the issues that we picked from the media, or from outside, or even from the social media, turn to be true. So I think, Waziri, it is important for you to stick into the issue and raise. If there is any document that you can table that counter, I think that is important. If the expose was talking about 46 billion that has been received by KEMSA, then it is important for you, instead of focusing more on what the media says, can you counter by documentation? I think that is being reasonable enough.
Thank you very much, Madam Chair. Indeed, that is why we are here with the documents that we have given. Those documents are specifically for that purpose. But Madam Chair, maybe you can give me guidance here. I don't know whether I'm supposed to table here what is in the social media vis-a-vis the actors who are there in KEMSA or not. Coming from social media, is that?
Not really. CS.
Thank you, Madam.
And CS, I think what would have done? You already said the matter is under investigation.
It is.
And so that is the information that you needed to give these members, that you had matters being investigated. Some people we have sent some people on leave. I don't know what the condition, just to update the members so that then we know. But
that is a specific
the way forward, members. Yes, just 1 minute, Senior. But the way forward is that members, even after, because we have received the documentation from the ministry and what has gone to specific agency, we will still have a chance to meet with all those agencies for their own accountability of the money that they have been given by the ministry. So this is a very important, as Honorable Nikal said, a very important document, because this is what we rely on. If there is 46 or whatever, I think the ministry has said now it's 23 billion. So we will do our own investigation. And so members, I think, will meet with all those agencies and we'll have to investigate and interrogate. That is our work of oversight.
Chair, I would have imagined, with your kind permission, that before the CS and the ministry sent KEMSA board or the CEO and his team on leave to allow for investigations, there must have had some investigation, their own internal investigation, which triggered now that showed that there was a massive theft of public funds. So maybe that is what he should table and tell us. We did our own internal audit, our own internal investigations, and based on these, we found that the KEMSA boss could not give an account of the monies that were given him. It is based on that investigation, internal investigation, that we called them multi-agencies, investigative arms of government, to come and do that. I believe it was not just from the bruise that he said, Kamatao, Shikao. There was a basis for that decision. Maybe that is what Waziri, my good friend, through the chair, maybe without telling the chair what she should do. That is the report that we. Let us also have a copy of it, because when the ministry needs money for COVID or any other business, you come to us. And now we are here today doing the oversight. We are now groping in the dark, not knowing whether there was an internal investigation or whether it was a whistleblower or what happened, to facilitate now the sending away on compulsory leave of the CEO and the director, Charles Juma. Thank you.
Chair, also on a point of order, Chair.
What is out of order, Honorable Koros?
Yes, I also wanted to inquire something from the CS, because what's happening now in the ministry, all the time there will be politics. So, Bwana Asiri, you want to tell me all these CEOs will be chased home just because of business in the ministry? Because all what's happening in the ministry is interest. And these CEOs, they have no role at all. Because for sure,
Honorable Koros, I'll not allow you to go through that route, because when you say they have no role, then you also have to table evidence that they have no role. So it's important that you allow.
Yeah.
And as I said, Koros, we will meet with all the CEOs. If they have no role, they'll come and tell us. So it's not good to preempt that they have no role, and we have not seen any evidence that they have no role in it. So, CS.
Madam Chair, thank you very much. First and foremost, on the issue of KEMSA, let me just finalize it this way. Number one is an ongoing investigation. Number two, KEMSA has a board. You know, it is not a ministry. It's not a Ministry of Health Department. Number three, the investigation within KEMSA is by the EACC, and they are the ones who are conducting investigations and making recommendations thereof, and that is in accordance with our laws. So if a CEO or an institution is concerned, they can call an audit, they can call DCI, they can call EACC. That is normal in our institutions, in the management of our institutions. The Ministry of Health does not micromanage institutions. Let us also be clear. We don't micromanage. We don't micromanage the board. We don't micromanage MOI. We don't micromanage Kenyatta National Hospital. Otherwise, it would be impossible. And it would be the very purpose for the creation of those institutions and the sagas that they are. MOI manages itself with its board, and that is as it should be. And any interference by the Ministry of Health would be at policy level. It is not at micro level. So, and we don't do that, and we are not going to do that. So, Madam Chair, I think if I raise that issue at that point, I think it'll be okay. The investigations will be carried out, and in due course, just like everywhere else, we will be told what the results of the investigations are. Madam Chair, in terms of the matters raised by the Honorable Nyikao, who is unfortunately left, I think there are some very important points that he raised regarding UHC and our capacity building in UHC. Indeed, what has happened, there's a silver lining to almost everything that we do in life. And what has happened, Madam Chair, is that because of all the activities that are going on at the county levels, at the hospital levels, the isolation facilities, the ICU facilities that we are building at that level, we are just upping up matters of UHC, because that is exactly what it is. What is UHC after all? It is universal health care. And what we have done is upped capacity that perhaps we would never have done prior to this pandemic. So the pandemic also has brought its own advantages in terms of capacity building at the county levels. And let me also say this: when we talk about isolation facilities, and when we talk about an institution like Embu Girls or universities or somewhere being an isolation facility, let's be clear also. It has simply been identified as an isolation facility in the event that we need to take people there to keep them there isolated and cook for them and feed them from there. That is not to say that we want people to be there so that we can say that this is an isolation facility. In fact, on the contrary, if we can avoid having any people in those isolation facilities, that is exactly what we are praying that we do. But as for the location, sometimes as for the location of isolation facilities, Madam Chair, let's also understand, when we go to those counties, we go wearing two hats. Number one is, yes, Ministry of Health, but when I go there personally, I wear the hat of the chair of the National Emergency Response Committee on Coronavirus, and the county management of coronavirus is vested on the governor and the county commissioner. These are the people who are the chairs of the management of coronavirus in each county. And I can tell the honorable member through the chair that yes, we have been to very many counties in this republic. And Madam Chair, at the risk of embarrassing you, when I was in Muranga, you were there. When I was in Kisumu, Nyikalo was there. I did not, Madam Chair, and I think it is good to confess, I did not invite the chair. She was invited by the governor and the committee. I did not invite Nyikal, yet all members of parliament, I have found a lot of members of parliament from Kisumu. In Kisumu, I did not invite any of them. They were invited by the committee. So the management of county by county is not a responsibility of the Ministry of Health. It is the coordination that we do. And when we go there, we actually tell members, the governors and the committee members, as much as possible, invite the leadership, so that when we come there, they can also get an opportunity to do so. But the critical areas, the location of a hospital, the location of an isolation facility, is by and large the responsibility of the county response committee that we have created. Otherwise, Madam Chair, it will be very difficult for officials from the ministry to go to Kwale and then start telling the Kwale governor where those facilities are going to be. And we would rather not get involved in the local politics, and local divisions that may exist there, the ones, for example, that the Honorable Njagagua is referring to, because we also don't know them. We also don't know those differences.
Clarification. Why I specifically brought out this cluster number 6 in Embu County? Waziri, you know the graphics of Embu. Now, is Waziri now, and this is where I want now the clarification, does he want to rubber stamp that biasness of the Embu County or the leadership of the Embu County governorship against the Mbeere? Because, Madam Chair, with your kind information, figures do not lie. Out of 16, or is it 14 isolation centers, there are only 2 from Mbeere. So since, and Nyikal was very clear. Honorable Nyikal said the ministry is in charge of policy and directions. So since I've brought out now that biasness, is the minister just going to sit and say that we leave that now to Embu? So that if anybody from Mbeere, from the lower side of Mbeere, wants to get isolated, they'll have to drive all the way 60 kilometers to Embu. Yeah. Is that what my good friend want to rubber stamp?
Let me assist my good friend, Madam Chair, and say, following that concern, I am going to direct the executive at the council to return to Embu and see what can be done in terms of the advice and policy direction that we can give in order to balance any unmitigated imbalances that might exist there. I think we can rest that matter there.
Thank you,
Chair. To my friend through you. Thank you. Mr. Chair, in terms of the, again, a matter raised by Dr. Nyikal, was the issue of accountability. And to add the following, that audit is a treasury responsibility. Let me just make it clear that in government, audit is an accountability aspect that is run by the National Treasury. And that even the members of the audit team that are in the various ministries actually are seconded by the Treasury. And they do it very well, if you ask me, because the Auditor General always comes out with these reports that says this is what has not happened. Whether action is taken or is a different matter altogether. And Mr. Chairman, Madam Chair, having sat in the Senate Committee on oversight, or that oversighted budgets, I can say without fear of contradiction that the role of oversighting county funds and county spending is squarely in the Senate. So the matter of the divisions that exist, the Senate has a role in oversighting counties, in ensuring that counties' money are spent properly, in ensuring that audits are examined, ensuring that the Auditor General reports are tabled by constitutional, in accordance with the Constitution to the Senate, and therefore some of the questions that are being raised to us should actually be raised with the Senate in terms of...
Point of order, put a point of order, Madam Chair.
What is out of order, Honorable
Yes,
Kutuni?
Madam Chair, is it in order for the Cabinet Secretary to claim that the audit and the oversight is purely lies with the Senate or the Ministry of Treasury? Whereas we understand that this is we are operating on a very peculiar situation as a country, where everybody must be accountable, including all of us as members of Parliament, and even Kenyans, and even the President for that case. So was it for you to raise the issue of saying that the audit lies squarely with Treasury and Senate? It's like you're running away from the problem. Today, issues that are being raised today, they are not being raised directed to Treasury. They are being directed to the Ministry of Health, where you are the senior person. If there will be any questions that are going to emerge, you will be held responsible. So I expect you to frame your statement in a better way. And Waziri, you've got a lot of experience. You've been a member of Parliament, you've been a senator, you've been a Waziri. This is not the first time. And we have a lot of respect for you, particularly your articulation skills. Sometimes we find it very difficult to kukushikilia na kukufinya. But Waziri, I think it is important for you to take responsibility on what is happening in the ministry.
Very well. Madam Chair, can I separate two things for the benefit of my brother Kutuni, Mheshimiwa Kutuni? Let us separate the issue of responsibility and taking responsibility for the Ministry of Health, which I do very gladly, especially because I know the work that is going on there. I know the very able doctors and health workers who are on the front line of saving Kenyans today. And I'm so proud to be the person who is actually heading that team that is saving Kenyans, which is the ultimate real work that is going on in that ministry. So that is number one. It's a question of responsibility and it's a question of the constitutional mandate to audit. The constitutional mandate to audit any document, any expenditure of money in this country is purely on two institutions, continuous audit by persons either seconded to the ministries as in ours. For example, let me give you a very good example. Part of the process of getting to where we got at KEMSA is an internal audit by ourselves, sending our own auditors to KEMSA. That's called responsibility. And we take it very gladly, and we are doing it. And that's why you see the kind of things that are happening in there. So that is number one. And then there is the issue of the actual technical implementation of an activity and a responsibility. The technical aspect of auditing and arriving at a report for Parliament, at a report for the Senate, is effectively the Auditor General. And you cannot steal the responsibility of the Auditor General under the guise of responsibility in other works in the ministry. So I hope it is clear. I am not escaping at all from responsibility in the ministry. I take it. I take it completely and proudly so. And I'm proud of the people that we lead. So I don't know whether that is clear, Madam Chair, or whether I need to explain it.
Chair, just a point of information.
Yes.
CS, you can remember when I made my remark that what Kenyans are looking for is value for money. It's not pegged to auditing only. For example, you have sent 300 million to KEMSA. And there is so many people without masks. And the infection is going up. So then we are losing the value for money. That's why I asked in the first place, do you have a framework or monitoring and evaluation that ties what you give out to the outcomes? You see, this is not in black and white, but this is a responsibility endorsed on you as the leading person with all the technical people. Are interventions being reviewed so that you can say this is worth funding, this is not worth funding. This is working, this is not working. It's not, because we know if the Treasury really disburses, it's their responsibility to follow that. If money comes from you, it's your responsibility. But it's also your responsibility for the ministries of the Treasury money that has gone. That does it make difference in the national
Absolutely.
fight for the COVID? So all these are in your plate.
I tell you, Mheshimiwa, through the chair, I think I have responded to that very clearly. I have made it very clear. We take responsibility for everything in our ministry. And as far as what you're talking about now is concerned, in terms of the formalities of the accounting procedures and so on, I also happen to have a little finance background. And I can confirm to you, we have got very clear procedures. We have got very clear finance and accounting procedures in terms of this is World Bank funding. We know the structures of the World Bank funding. This is Treasury funding. It is very clear that this is how the Treasury funds itself. It is very clear what our role in the whole matter is. And I agree with you. Money that is sent to us, particularly money that is directly allocated to the Ministry of Health, must be accounted by the Ministry of Health. And the ultimate, and the buck stops at my desk. And that's an acceptable position, completely and totally. And if we don't take action, then it is us who will not have taken action. And sometimes when we take action, and people come and tell us, you are firing away my tribesman, or you are firing away my cousin, and then we go back to square A. These are some of the issues we face, but with responsibility. And we do so with clarity as well. There is no mandateness in terms of what is supposed to happen and what is not supposed to happen. So clarity we have. So if I hope I'm clear now, because what I would hate to do is to walk out of here and you say that he didn't quite answer that. Let me make it clear. We have got input. Input being the amount of money that we send to this institution or the other institution. We expect those institutions to, one, if it is, for example, if it is to the counties and we have given a condition of grant, we expect the institution to follow what we have said. We will also expect to get a report from them, which is going to inform our accounting, ourselves, as far as the Treasury is concerned. And secondly, the instructions that we give are in accordance with the needs that are there in the country. You cannot go and say, let us buy HIV medicine instead of malaria medicine, when malaria is the issue, not HIV, or vice versa. So the need is what informs what we have ordered for purchase, and in fact, even what we are getting from donors. So, and I can tell you, Madam Chair, that the reason why these debates are going on currently is because we have done exactly that. We have unearthed ourselves. We are the ones who have unearthed some of the malpractices that might be going on and that are under investigation at the moment. But sometimes, if you go somewhere and you start an investigation with your own space, it isn't assumed that it is somebody else who started the investigation and you're hiding something. We are the ones who are unearthing, not hiding.
Madam Chair, just a follow-up on what Waziri said and what Honorable Wino was driving at. It's about the masks. I know about 3 months ago, Honorable Waziri, we sat with you through a Zoom meeting as we're passing the COVID regulations. And one of the issues that we passed for you as a ministry is that anybody who does not wear a mask will be committing an offense. And of course, an offense has a consequence in terms of a fine. As you drive in Nairobi and out of Nairobi to the counties, so many people are not wearing masks. And the reason is, many of them cannot afford a meal. So is it food that they'll put on their table, or is it that the masks that they'll have to buy? Fortunately, for the ministry, you say there's about, is it 300 million? But the ministry has not come around to doing the procurement. And we are about, is it 5 months to the COVID season? So is it that we let the Kenyans pass on this disease to others, and money is there? Si mnasemanga kuzuia ni kuzuri kuliko kuponya. Maybe you can expand on that, Honorable Minister.
I think let me finish with this issue once and for all. This money came at the end of the financial year of last year. And we have also said, you know, Madam Chair, unfortunately what is going to happen is this. Had I gone out and gotten a company called Njagagua Limited, for example, you know, to start manufacturing these masks, I would now be here answering the question of how the heck did I purchase from Njagagua Limited and not follow the procedures that are supposed to be there. So make up your minds. I mean, there's an emergency here. There's an emergency situation, yet we have to follow certain procedures. And let me make it clear on this one, Madam Chair, and I beg for patience on this one. What we are trying to do with this particular one is ensure, and Madam Chair, you know, I don't know which areas my good friends have been observing, but one of the biggest problems is not lack of masks. In fact, when you go around this country, and I've done a lot of groundwork in the country, it is not really lack of masks that is a problem. A lot of people are wearing masks. Even when you go to Eldoret, Kisumu, or Nyeri, or whatever, a lot of people have masks. The issue is not having a mask. The issue is the way they wear the mask. That is a bigger problem for me than the fact of masks. But having said that, we are going to supply people who are needy. Let's make it clear. A jobless person, a person who really can't afford to buy a mask, are the people we are going to give masks to. Not all Kenyans. Because
is a minister, is a CS in order to misread this honorable house on matters of procurement?